there's plenty of things like in kind of my individual job, that lack of efficiency, and somebody joined our group recently as, kind of like, wow, you do a lot of clerical work. I'm like, yes, we do. Yes, we do. We could change it. In terms of pediatrics in general, I don't really, I don't have a good answer for you, but I will say that I think on a larger scale, one of the things that a lot of pediatricians find very frustrating is that the way our healthcare delivery system is set up and incentivized, it kind of incentivizes the wrong thing, because everything goes through, insurance companies, and insurance companies are primarily for-profit organizations. And so they want you to bill the most number of what they call RVUs, relative value units. So if it's a more complicated patient, it's a higher number of RVUs. If it's a less complicated, it's less. But basically that puts the pressure and incentive for people to schedule patients, like one of the groups around here does, like every 10 minutes. Well, I mean, I don't know, like, I don't think with my particular approach to medicine, like, I don't think that'll work. And I think, sure, you could get patients in and out in 10 minutes, but I don't know that you could actually either, for some patients, get to the underlying problem in 10 minutes. The stated problem might be that their heart is racing. The underlying problem might be that they've had some, significant social stress in the last 6 months. Maybe a parent died. Maybe, a relationship is really weighing heavy on them. And you're not going to get to that level of conversation with somebody in a 10-minute visit, So, so I think that is a big part of the frustration of where medicine is right now. And in response to that, there have been more and more people who are going off and doing like concierge practices, for example, where people might pay a flat fee for the entire year and then just not pay for individual physician visits. And then, they have the doctor's cell phone, or they just, the doctor will do house calls, or they'll, and there's different models out there. There's a bunch of different things, but it's kind of, in some ways, trying to recapture what like doctoring used to be like, where people could spend the time that they needed to spend for that individual patient. And maybe they only needed to spend 5 minutes. I mean, if you were just in to get like your ear infection rechecked and make sure that it's gone and the antibiotic worked for you, like that doesn't need to be a long drawn out thing. But if you're there for a more complicated problem, I mean, it takes a little time to both sit down and really listen, like I was talking about before, like listen to what a person's experience has been with this thing, and then do enough of an exam that you can kind of figure out like where you're going next. And our current system does not incentivize people to do that. In fact, it kind of penalizes people for doing that, because a lot of that you can't capture with a billing thing. Fortunately, like where I am, and this is probably part of the reason that I really enjoy my job right now, is being in the hospital. It's not really reimbursed so much on time or specific levels of things. I mean, it's all kind of bundled charge. So if I need to spend more time with a family, I might just get home later. So I feel the freedom to take the time that I need to take and talk to people to the point that it seems like, we've taken care of the issue, or we've addressed the issue in whatever way is needed. So yeah, I mean, I don't think anybody has clear answers on like how exactly we can change or do it better. I mean, of course, that's a very political, hot topic and flashpoint on what everybody wants to do differently, and different options out there. But I do feel like where we currently are is not good either for patients who can't get the care they need or get misdiagnosed because somebody's rushing. Not intentionally, but they don't have that much time.